I think what Senator Sanders is saying certainly makes sense in the terms of the inequality that we have. But we are not Denmark. I love Denmark. We're the United States of America.
Since the COVID-19 pandemic hit our shores earlier this year, I've been one of the lucky ones. Thus far, I've remained relatively healthy and gainfully employed. So too with most of my family and friends. I can only hope that this doesn't change. So while I have very little to complain compared to others, I have to say that the virus has taken a toll on me in its own way. As a news and politics junkie, it's both frustrating and depressing that the news cycle is dominated by one story, and a particularly sad story at that. One of the most draining things about all of this is the constant inundation of contradictory information. As someone who tries very hard to find clarity, I often feel overwhelmed by how much divergent data comes across my radar, especially since I have no expertise in any of the relevant fields. Wearing masks is the key to keeping the virus in check. Masks don't work. Sweden has achieved herd immunity. The virus has mutated and therefore any immunity is weak. The virus is hardly lethal to children. Children are at just as much risk as adults are. Hydroxychloroquine can help. Hydroxychloroquine doesn't do anything, and on it goes. So when people ask me if I think the US has done a good job of handling the pandemic, my honest answer is probably not. But frankly, I don't know. If the results thus far are any indication, then we've handled it worse than just about any other country in the world. However, the unfortunate reality is, not all of the results are in yet. I wish this whole thing was over, but the virus has not run its course yet, and a proper judgment can only be made retrospectively. And of course, the only fair way to assess the performance of our institutions and the people in charge of them is to evaluate their response based on the information they had available to them at the time. It's the easiest thing in the world to be a Monday morning quarterback. It's a lot more difficult operating in the fray, especially with a novel disease like COVID-19. We really are flying blind. All that said, I do believe that the pandemic has validated one of my priors. A nation is more than its institutions. The success and failures of a given country go beyond the rules established by its legal authorities and include, but are not limited to, culture, geography, history, and demographics. An easy example of this is to compare the United States to New Zealand. While the US has some of the worst results when it comes to COVID-19, New Zealand arguably has the best. New Zealand has successfully flattened the curve, registering just over 1,500 cases and only 22 deaths. These are significantly lower numbers per capita than not only the United States, but most other countries in the world. Another nation that has had similarly low rates is Iceland. While I'm sure these nations have responded better to the pandemic institutionally than others, there's another obvious factor at play here. Geography. It's much easier to contain a contagious virus when you're a small island nation than when you are a large, populous country like Brazil, India, or the United States. Going back to the domestic front, why do you think New York City has had a larger per capita breakout than Casper, Wyoming did? Did New York's political leaders like Andrew Cuomo and Bill de Blasio make bad decisions? They surely did. Putting COVID patients in nursing homes so that they can mingle with some of our most vulnerable citizens strikes me as a bad strategy from a public health standpoint, but then again, I'm no expert. That said, it would be foolish to suggest that bad decisions were the only factors behind the Big Apple's outbreak. The fact that New York City is one of the most densely populated areas in the country, it's one of the most highly traveled cities in the world, and much of the population relies on public transportation, all likely contributed to the city's high number of cases. The fact that none of these things are applicable to Casper probably goes a long way in explaining why the per capita cases are so much lower. But obviously there are areas in the world that have similar qualities to New York, but have done a good job of containing the virus. Tokyo, for instance, is even larger and more densely populated than New York City. Yet the entire country of Japan has only recently topped 1,000 deaths. As I write this video, New York City alone has over 23,000 deaths. So how do we explain this difference? Well, again, I'm no expert on the virus, and I know even less about the ins and outs of the Japanese response to it, but if masks are really a key component to containing the pandemic, then we may have a good explanation. You see, wearing masks is already the norm during cold and flu season in the densely populated East Asian countries, Japan in particular. As Motoko Rich, the New York Times' Tokyo bureau chief explains, masks are already common in Japanese culture. Face coverings are nothing new here. During flu and hay fever seasons, trains are crowded with commuters half hidden behind white surgical masks. Employees with colds, worried about the stigma of missing work, throw one on and soldier into the office. Masks are even used, my hairdresser once told me, by women who don't want to bother putting on makeup. Japan, I think a lot of people agree, did everything wrong. With poor social distancing, karaoke bars still open, and public transport packed near the zone where the worst outbreaks were happening. Jeremy Howard, a researcher at the University of San Francisco who has studied the use of masks, said of the country's early response, "But the one thing Japan did right was masks. Japanese leaders eventually essentially urged karaoke bars and other businesses to close and cajoled employees into teleworking. Schools were closed at the beginning of March, far earlier than most countries, and large cultural and sports events were cancelled. But one of Japan's most visible responses has been the near-universal mask wearing, seen here as a responsible thing to do to protect oneself and others, and as a small price to pay to be able to return to some semblance of normalcy. Let me repeat a part of that last sentence. Seen here as a responsible thing to do to protect oneself and others, and as a small price to pay to be able to resume some semblance of normalcy. So it's not just that masks per se are normal attire in Japan. There are also intangible parts of Japanese culture that are particularly useful during a pandemic. Most notably their sense of conformity and a willingness to sacrifice for the greater good. Now, compare this to the way many parts of American culture have treated the virus. While a solid, silent majority of Americans have gone along with mask mandates, there are still plenty of holdouts, many of whom have become stars of viral videos.
She says she has a right to her pizza. Another customer captured this video inside the Papa Murphy's in Kennewick as the woman berated the staff for refusing to serve her because she wasn't wearing a mask. She claimed there's no need to wear a mask and that she has a medical disability. She paid for her pizza online but refused to give the workers her name. They offered to hand her the pizza outside. Eventually she left, but a man she was with got out of a white pickup and continued the rant.
Whereas Japanese culture places an emphasis on conformity and the greater good, in American culture there's a very heavy streak of rugged individualism and obstinacy. The American approach to problem solving has traditionally been, we'll figure it out as we go. It's not a terrible strategy because it's certainly worked for us before. A pandemic, however, is a unique situation where that approach is very unlikely to work. Our frontier attitude that we pride ourselves on, that makes us so difficult to govern, can manifest itself in ways that are frankly dumb and irresponsible. So, in Japan, people were willing to make a small sacrifice to be able to resume some semblance of normalcy. However, here in America, a lot of people got to the point where they basically acted as if the virus didn't exist. See the Ozarks on Memorial Day. Again, my point is not that institutions don't matter. They absolutely do. Even from the narrow standpoint of masks, the Japanese government did things much better. While the CDC was telling Americans masks weren't necessary, the Japanese government was actually purchasing them and providing them to their citizens for free. I have no doubt that that helped with compliance. My point here is that culture and other factors matter too. I don't believe that access to masks is the biggest problem here in the US. Culture is the driving force behind the different rates of compliance on the specific question of masks, and an important factor in the rates of compliance of other protections against the virus generally. Think about it. There are people in this country who refuse to go along with the program purely as an act of rebellion. They don't like being told what to do, even if what they're being told is good for them and their family. This all goes back to one of the most misunderstood concepts in all of politics: American exceptionalism. A lot of jingoistic morons on the right and anti-Americans on the left both seem to think that this means we're better than everyone else.
They want to do their propaganda about the United States and talk about American exceptionalism, which, by the way, what's another term for exceptional? Supreme. So American exceptionalism is really American supremacist. You think we're better because we're American, period. That would be supremacy. If we're better, that means by definition that others are inferior. So we are superior, they are inferior. In other words, you're a bigot against everybody who's not an American. That's what it is. Again, this is just logical deductions and looking at the words and breaking it down. I mean, that's what it is. So American exceptionalist is American supremacist.
That's not at all what was meant when the concept was originally conceived. Exceptional also means unusual, and it's this sense of the word that was used when Seymour Martin Lipset invoked the concept. According to The Guardian, Lipson was the leading theorist of democracy and American exceptionalism, due to his emphasis of America's uniqueness among nations. Lipset was enamored by the fact that the US was more violent and religious than other industrialized democracies, that it had a far more individualistic culture and a far more dynamic economy. American exceptionalism had both good and bad connotations, according to Lipset, but more important than anything was the fact that America was different. And that's my point here too. America isn't like other nations. That can be both a good thing and a bad thing depending on the circumstances. During a global pandemic, having a more conformist culture like Japan would probably serve us better. That said, such a culture also lends itself to things like fascism much more easily, which sadly Japan descended to in the 20th century. While the United States' anti-authority streak can manifest itself in silly, destructive, and even paranoid ways, it has served as a useful inoculation against tyranny. Hopefully that remains the case going forward. So if you agree that America is exceptional in this regard, and you agree that things like geography, population, demographics, and culture matter in the response to COVID-19, I want you to consider something else. All of these things have other policy implications as well. We hear a lot about how nations with national healthcare get better outcomes than the United States. That's certainly true in a lot of cases, and it may well be true that their particular healthcare system played a role in achieving those results. It might also be true that the unhealthy American diet and general lifestyle play a role too. Many on the left have praised Australia's gun confiscation efforts and New Zealand's willingness to implement gun control after a mass shooting. They tell themselves these bedtime stories that, were it not for the NRA, we could do the same thing here. But do you honestly think that with our love of guns and our general gun culture, that we would be so compliant? I highly doubt that. There's nothing inherently wrong with looking to other nations for ideas. We can certainly learn a lot by doing so. But people need to rein in their expectations in this regard, especially these people who think that we can solve most of our problems by adopting the Scandinavian model. Implementing Danish institutions doesn't necessarily mean you're going to get Danish results. I'll be talking about this more in my next video, so stay tuned.